Hello, and welcome to TBD Didactics, your resource for medical education. My name is Dr. William Schiff, third generation urologist and co founder of our company, TBD Didactics. Today, I want to spend a moment to talk about the value of a vacuum tumescence device during the course of rehabilitation for men who come to our office for sexual dysfunction concerns. What we normally ask, regardless of the age, is what kind of morning erections do people enjoy? Often, because of a variety of issues, people are no longer seeing the morning erections they experienced when they were 19 or 20 years of age. The vacuum tumescence device, a simple handheld unit that is manually operated, can offer dilation of the blood vessels of the penis, improve blood flow, and improve oxygenation of the penile tissues. And we do this for a variety of reasons. One, the stretching of the blood vessels and re-nourishment of penile tissue with blood and oxygen allows for rehabilitation. Very similar to going to the gym for exercising. The more you exercise, the stronger you get. We use this also as an adjunctive treatment to other forms of treatment like Viagra type medications, PDE5 inhibitors. Some men, depending on the frequency of intercourse, will use the vacuum device as a primary source of erection and enjoy penetrative intercourse with their partner. For rehabilitative purposes, we can use mechanical dilation daily. Simply place the penis through the canister, apply an airtight seal, and offer a pumping motion to offer negative pressure, dilating the vessels, bringing in improved blood flow, bringing improved oxygenation. We do this exercise over a period of 30 minutes, pumping up for about 2 minutes and letting the vacuum release. Pumping up for about 2 minutes, then again, letting the vacuum release. Do this 4 to 5 to 6 times over that 25-minute period daily. If the couple chooses to utilize this for penetrative intercourse, once the vacuum device has been applied, we can use a constriction band similar to this to place over the shaft of the penis to the base, constricting it and keeping the blood flow in. This can be employed for approximately 25, 30 minutes. What we don't want to do is keep the constriction device on for longer than 30 minutes. This actually cuts the blood flow to the penile shaft. So if your engagement lasts for longer than 30 minutes, people will loosen this, revascularize, repump, and then reapply the constriction band. Using this daily for rehabilitation, adjunctive treatments, along with other kinds of treatments, or utilizing this primarily for intercourse, all has great value. We encourage you to use this. We encourage you to listen to your urologist, the sex expert, to help you decide how to improve your sexual health.